Okay, folks, welcome to our next session. Thank you to all of you who joined us for our presentation here with Bryce Ward. Before I turn this over to our two distinguished guests, I want to just do a couple of quick things. I want to just note Bryce Ward talked a lot about the nature of trying to foster sector growth and how that comes about. I think what we're going to hear today for the rest of this day is a strong case that we have had decades of good luck and good fortune with people finding their way to Montana who are extraordinary in the fields of bioscience, biotech, and technology. We're going to hear, I think, that many of those people were instrumental in assisting our governor in his efforts for navigating us through COVID. And before we turn this over, I just want to take 1 minute here to just acknowledge and thank a tremendous list of sponsors who not only sponsored this event, but I think are leaders as well in this field and this area. The Montana Bioscience Cluster Initiative, based out of the University of Montana, C2M Beta, powered by Blackfoot, the Governor's Office of Economic Development, grateful for your support, Two Bear Capital, and the Montana Bioscience Alliance. So we're incredibly grateful to all of our sponsors for participating today and helping us out with this event. I am just proud to be a Montanan, and in part, just thanks to the extraordinary company we all keep in this state. I know that when you are called upon to respond to a crisis, it really does demonstrate who you are and your character and your leadership. I'm grateful to you, Governor, for your leadership in getting us through COVID at a time when we were really left to our own devices as states and communities to navigate much of this. Marshall, a longtime friend and distinguished scientist in this field, the director of Rocky Mountain Lab. The two of you I know have had many conversations over the last several months. I can't thank you enough for allowing us to sort of come into these conversations and hear from you how this has gone and sort of how you've seen this unfold. So without any additional delay, I'll turn this over to you, and thanks again for your time today.
I thought we were supposed to talk about trout fishing. Well, Governor, what a pleasure and privilege it is to have this opportunity to talk to you and hopefully to take you away from something which was a lot less enjoyable than this little chat. And again, I want to thank you for your terrific leadership and express my regret that you weren't able to come over and meet with some of the scientists and hear firsthand about the experiments that have been done here at Rocky Mountain Labs. But I know you've been following them closely, and your interest in that is certainly greatly appreciated by our staff. So the topic for the 2020 Big Sky Insight Summer this year, Insight Summit, is on the COVID, as you might have guessed, the COVID-19 pandemic and how the various biomedical research, often referred in the vernacular as bioscience, and the health sectors and education sectors in Montana were able to aid in our state's strong response. The topic for the entire first day is called Montana's Strong Foundation, which Grant alluded to, and how that strength played a role in our state's relatively robust response. Our talk this morning, which is way too brief, provides a unique opportunity for the attendees to hear the view from the governor's office with a little bit of prompting from me. So my plan is really just to ask you a few kind of open-ended questions and then to give you the chance to offer your insights and perspectives. So the first question, and unfortunately it's a multi-part question, is so experts who work in pandemic preparedness and planning, and I am not one of those, sort of divide the subject into a couple of phases. There's the interpandemic phase, which is where there's general awareness of infectious diseases and surveillance and vigilance for agents that have pandemic potential. There's a pre-pandemic phase, which is sort of the heightened awareness that an agent with pandemic potential is starting to cause problems somewhere. And for this current pandemic, that started around December 31st, 2019. Make preparations for transmission scenarios and impacts, response, readiness, et cetera, everything you would do for any other kind of emergency, but with a public health point. Then there's the pandemic, and that means a worldwide spread. And this pandemic was declared by the World Health Organization on March 13th, although you didn't need to be a genius to see it coming. And the U.S. declared a national emergency on March 18th. And this is where we are now. And then the final phase is the post-pandemic phase, and I think I'll ask you about that in a little bit. So what I'd like for you to do is to reflect on how the state's assets, government, academic, medical and hospitals, and scientists like here at Rocky Mountain Lab, were able to be brought in to assist you in the state in the various phases of the pandemic. So.
No, that sounds great, Dr. Bloom, Marshall, and thanks so much for doing this. And for those that don't know about the good work of Rocky Mountain Labs, it really is such an asset and a jewel for Montana, and really makes such a significant difference all across our country and indeed all across the world. So thanks for the good work that you do. You know, I often say that Montana is sort of like one small town with a long main street. And we've really seen that throughout the last 7 months when it comes to dealing with COVID-19. I think of early on where it's no exaggeration to say at least a couple times a week was on the phone with all of the hospital administrators trying to figure out whether or not they have the PPE that they need. And them giving us insight, a pipeline into literally how many N95 masks they have. Because when you talk about the pre-pandemic stage, as an example, the preparation, from my perspective, wasn't necessarily there. You know, remember getting 50,000 N95 masks from the state of North Dakota, which is more than we'd gotten from the Strategic National Stockpile, which was something that made such a meaningful difference. And in sort of our small state, small town environment, and even today, we have National Guard folks all across this state helping out with testing and bringing folks in at times to some of our long-term care facilities when necessary. And leaning on others outside of government. I mean, first, there's both state and local public health, which is a coordinated response when we come to contact tracing and isolating and trying to make sure that, look, the best way to curb this is, first of all, for Montanans, and Montanans really did come together at the start of this, like when we did a stay-at-home order and things, and that's what kept our spread significantly down and among the lowest at the time, actually the lowest positives in our country. But the connectivity through not just government and not just through local government, but being able to rely on some of our bioscience businesses like Fire Labs, as they and now are standing up testing, group out of Missoula, spending time with Inimmune, who isn't looking at what happens over the next 9 months, but what do we have to be doing a year and a half down? And it's been really exciting to see an all hands on deck moment in a moment of crisis where I don't care if you're an educational unit, I don't care if you're private sector, I don't care if you are a hospital, everybody's coming together to say, how can we address the challenges here and do it in a way that we recognize. Well, I'll give even one example. I was talking to someone at the Fort Peck Nation. This was a day ago, and they said, look, our hospital all of a sudden doesn't have enough vent tubes. So they can't wait. So we all kind of came together and said, we can get you the resources immediately, and then let's address the long-term challenge. So it really has been, the optimistic side is that when Montanans face an emergency, we all come together and figure out the best way to actually try to address it. And I've seen just incredible folks working so many hours to figure out the best way through all of this.
Yeah, I know. I think it's been it's been very impressive. I had the privilege of sitting in on the Montana Infectious Disease Doctors Network, which your health department, which our health department put together, and to see the level of interest and concern from one part of the state to the other. Certainly within the state of Montana, there was reluctance to no reluctance to jump on board and do whatever we could, even if some of the things we weren't actually able to to do. But it's that part of it's been very inspiring. Not every part of it's been quite so inspiring in a positive way, and so that leads to the second question, which is, what kind of communications did you have with federal officials, and were they able to give you the answers and the assistance that Montana needed, and did they deliver on those promises? And how are you, and you sort of mentioned this a second ago, how are you able to sort of marshal the in-state assets to help compensate for the shortfalls that I know you had?
Yeah, and there's so almost every week since March, I've had a call with the Federal Coronavirus Task Force. So that includes the Vice President, more often than not, Dr. Fauci, Dr. Deborah Birx, the head of Health and Human Services, and so many of the other folks. And like on the one hand, the communication has often been pretty darn good. But from the start that they said this will be a locally executed, state-managed, and federally supported public health emergency. And I have had my share of frustrations at times that federal support wasn't always there. I mean, when they were trying to set up supply chains, and I knew that if I got personal protective equipment, as an example, what I would do is immediately ship it out to all of the hospitals, first responders, and DES in need. But I was spending, no exaggeration, up to hours a day trying to be a supply clerk, finding ways around the federal channels. Or never forget a time where we were literally one day away from being out of testing supplies, which would have shut down all testing along the way. And even then, when we, and I'll say I've worked with some incredible people in the federal system that have been doing their level best to try to figure out paths around this. But as an example, look, we didn't have the testing capacity that we needed. So worked with the administration. We got a reference laboratory that said, okay, they'll take Montanans. And then all of a sudden it became, a 7 to 10 day turnaround, and we're not even going to take them. And that's when folks rolled up their sleeves. Like Montana State University is processing over 1,000 tests a day right now because we had to find other solutions. Sometimes there's been a disconnect. Like I was literally on a call that said, oh, you have testing problems? Call Marshall Bloom and Rocky Mountain Lab because all of our federal facilities will be able to take care of that. Well, you and I know that doesn't quite work as it should. So there shouldn't be, look, at the end of the day, we're all in this together. And there was at times sort of saying, well, we're all in this together, but you're on your own, states, and had to find the ways to get what we needed. Now, I will say from when it comes to some of the testing supplies example, like, at one point, I bought our own 3D printers to start making nasal swabs. But supply chains certainly have improved a heck of a lot better since early March. And, we probably should have we should have invoked the Defense Production Act a little bit more robustly so that governors weren't acting as supply clerks. But back to even the first question, as MSU said, all right, we'll figure out a way to stand up testing. And U of M just, I think, got CLIA certified, so we'll be able to do things there as well. As the private sector has said, we'll try to help provide some of the assistance along the way. That part has been inspiring, even though at times I think that the federal support, and it's not for lack of trying for some good folks, but was pretty well strained.
Yeah. One thing that popped into my mind as you were talking was, I know you had you and the vice president and the task force had calls with the other governors from around the state. And I imagine if we were having this discussion with a lot of those other governors, we'd be hearing exactly the same thing you're saying about the challenges and the successes and the inspiration. But I'm just kind of curious, in those conversations with the other governors, did you get the impression that Montana was really unique in the way that all of the educational, research, and medical assets came together to assist? Or was that a common theme that you heard from multiple other governors?
Well, and it was funny, Marshall, because even early on through this, we also had weekly calls with just the governors. And, many times, and it might be striking in some respects, but like at 10 o'clock at night, I'd be talking to the governor of Illinois. Now, Illinois and Montana are a lot different, but we'd be both sort of commiserating of what we're not getting and brainstorming of how we could, at the end of the day, do better and do right. And I do think, a number of other states really did rally around the same way that we did at the local level and say, let's look at the assets that we have here and let's figure out ways to actually enhance our ability to do things. And it was great even from that perspective. Like, I think that, like, we have a state vet lab. Well, there's a piece of equipment that I knew if I got over to our state public health lab, that would significantly increase the ability for tests. And we surveyed, and we knew where every single sort of test processing machine was in our state, in our hospitals, and could work to say, all right, you hospital, you're going to take up part of the load. We'll try to get some of the equipment. So I'm not sure if every state sort of had the successes that we did in doing that, because it is sort of like an all hands on deck. Like, I called the Commissioner of Higher Education, and the university president said, whatever you need, we'll help provide that assistance. And it's not sure that every state has sort of that seamless coordination that we do, but I think every state was relying on it for sure. Yeah.
Well, I think a lot of that relates to what you said, being a small town with a long main street. And if my memory serves me right, you also were able to provide one of those machines to reuse to disinfect the N95 respirators, and there was a huge shortage in those initially. So that was also a really proactive move.
Yeah, we found actually it didn't work quite as well as offered. So from that perspective, we did it for a little while, but then we really amped up the supplies that we have. And like, I know right now that we have well over a 3-month, back to your pre-pandemic.
Yeah.
Like, I know right now, even if the wheels fell off of all supply chains, that I've got Montana covered for at least 90 days. And when I say Montana, this isn't just the DES and first responders. It's what our local providers would need.
Yeah, well, that's wonderful. The first real exposure I had to the intersection of science, and it was veterinary medicine and government management, had to do with whirling disease back in the mid-'90s when Governor Roscoe asked me to and that was a pandemic too, except it was among our trout brethren instead of our two-legged brethren. And it became, clear to me that the intersection of government and education and, advocates was really, really important. And that's always sort of stayed in my mind as I've had to deal with various infectious disease outbreaks. And it sort of it gives me a basis for the third question. was, what about the challenges of offering solid, sound, science-based communication and management strategies in the face of misinformation and the contestatory social anthropology that's commonly referred to as politics? I mean, it was like, I think it was Dr. Fauci said early on, he says, we got two pandemics going on, you know, the pandemic with the virus and we have the pandemic with the disinformation. And, you know, they both can do a lot of damage. So how did you draw on the various assets to help you, you know, provide a consistent message?
Well, and I think right now, to be honest, Marshall, I mean, we're seeing that more than probably, in some respects, all throughout this pandemic. Like, look, I've always looked at this as this is the largest public health challenge we've faced in a century. And it's the largest economic challenge we've faced in a century. But guided by the public health crisis and the economic crisis, not a political crisis, and leave the politics out of it.
Yeah.
And not everybody feels that way. Like, I think, like, when we did a stay-at-home order, we were before half the states in the country. When we shut down our schools, the whole Eastern Seaboard hadn't shut them down. Washington State, where the first outbreak. But more than what I did, Montanans responded. And that's what made it so we had among the lowest cases in the country. And now we're in a place where, you know, I think we're seventh lowest unemployment. Moody's says we are among the top 10 to recover because we took it seriously at the start. But somewhere along the line, right, and I even think of, like, when I was saying, asking Montanans to stay at home and closing down all non-essential businesses. There's disconnect because the administration was saying, oh, we'll all be open by the 15th of April. And that disconnect is something that I think we continue to battle with a little bit, because you know a lot better than I do, having done what you've done through your life. This virus doesn't care about politics, right? It just wants to find a host, and it wants to be able to spread. And we know what the best practices are. Like, we know that social distancing, washing our hands, avoiding large crowds, and wearing a mask is what's going to limit the transmission until we get to other steps like a vaccine. And it's unfortunate that in some ways that sort of public health should never have political divides. Now, I've also recognized that there are things that all say that doesn't matter, but when you have doctors, when you have scientists like you standing up, then that can tamp down sort of the politics of it and say, like, this is about public health. And when an ER doc speaks about what's happened at the hospitals, or an infectious disease doc talks about it, that I think really can have that sway. And I get folks are tired. We're all tired of this. I'm over the virus. I just wish the virus was. And until the virus is, we've just got to figure out the way to make sure that we are taking the steps, because we are a caring community, to take care of our whole state.
Yeah. And, you know, to me, one of the most appalling things, especially in the state of Montana, is that we should find our local public health officers and departments basically driven out of office because of threats against them. And you know, that was totally appalling. But, you know, I mean, we live in a fractious world, and Montanans are nothing if not fractious. So I think what I want to do is I want to just ask you the final question, because we're going to run out of time. It's been such a pleasure. So the post-pandemic phase is when you really have to focus about resilience, recovery, continuity of operations. And in this case, given the timing, this means providing a solid proposal and a framework during the transition period for the next governor. And I'm just curious, are you going to intend to sort of keep together these coalitions that we're talking about between government, industry, academia, and everybody else? How do you go about making a case for transition with that, which I think is a very good approach to the next administration.
Yeah, I think first spend a lot of time with the next administration, not just me, but my public health experts. Major General Matt Quinn, who runs the National Guard, but is actually, I've tasked he and some of his people with so many of these, and sitting down and saying, here are the lessons learned along the way. I mean, we know that there's two ways we're going to get out of this. One is, right, a widely accepted vaccine. We don't want to rush that. We want to make sure that it is actually going to be effective. And look, at the state level, we've always prepared and we'll be ready for large-scale vaccine distribution. I mean, working off experience with H1N1 and other things along the way. And the second is that we all continue to take this seriously and limit the spread. We are seeing concerning numbers right now.
Yeah.
So I'm going to give the next administration everything that I've learned and the roadmap to go forward. But there's also some decisions that are going to have to be made. Literally, all of both the CARES Act dollars, the testing dollars, on and on, ends December 31st. And so hopefully Congress gets its act together, because I'd love to say this virus is going to go away after the election. It's not.
Yeah.
But give them the blueprint, our best knowledge along the way, and the encouragement to really look at this as a public health and an economic crisis, not the political challenges that become infused. You know, I've been so lucky to get to work with incredible people, not just here in Helena, and not just like our epidemiologists and our public health crew, but incredible people all across this state. And hopefully the next administration will lean on them both for the assets, but also for the information sharing and pushing out what those infectious disease docs and others can do to make sure that in a time of great uncertainty, that we have as seamless of transition as possible, because the state and our local communities, especially where there's significant spread, cannot drop the ball on this. There's just too much at stake from the health side and an economic side.
Yeah, and I completely agree. And I think we've got about 30 seconds left. And I just want to make sure that, and I think I can safely speak for the others involved in all these various sectors, that I hope that you will convey to your successor, whoever that might be, the willingness and the desire of the entire state to get behind their efforts too. And again, it's really been a privilege and a pleasure to get to talk to you. I'm sorry we weren't standing in waders on the Big Hole or the Bitterroot River, but maybe we'll get talking, but maybe we'll get that opportunity. And I think with that, we are just about out of time, and we'll wait for Grant to, there we go. Grant to come back on.
I appreciate it, Marshall. I'm going to take you up on one of these days on that fishing. And I'll tell you like another thing about the small state that Montana is, that like I have Dr. Bloom's cell phone. He has mine. And I have called on him a number of times asking questions and things. So appreciate the good work that you do. Back to you, Grant.
Well, thank you so much, Governor. We appreciate your time. We know that every minute is precious right now. Dr. Marshall Bloom, thank you so much for your time. We're really grateful for you both. That was a really helpful conversation. I think it really sets the stage for what the rest of our conversations look like in the remainder of the day and the days ahead. I think, we heard from Bryce Ward earlier this morning that one of the challenges we overcome as a community trying to grow our bioscience sector, our health sectors, is the challenge of being relatively distributed smaller towns compared to some of those who have bigger epicenters of biosciences. And I think that notion of the relationships we have of that small town with one long main street is exactly the tool that we will use as Montanans, and we have used as Montanans, to punch above our weight when we try to grow this sector, when we try to capitalize on our strengths, when we're meeting these challenges, and when we're planning for and preparing for the future. So thank you both. Appreciate your time, appreciate the work that you've done, and grateful for the work you have yet to do, because I know there's still a long road ahead.
Thank you.
Okay, for the rest of you, just a quick update. So we will take a break here for 10 minutes. We'll join Marshall Bloom and a team of industry experts and leaders, some of who were just referenced by Governor Bullock in some of his conversations. Talk a little bit about the history and the strength of the bioscience health industry sectors in Montana and why we do have sort of fertile soils to continue moving forward. Thank you for joining us, and we'll look forward to seeing you in 10 minutes.